The other day, I sent out an email with a letter from Dr. Sheldon that was called Fee for Outcome, which is different from what we talk about a lot, which is fee for service. So there's a lot to say about this fee for outcome, and I think it's very important as private practice facilities, doctors, to know that in that writing, what I think rings most true is patients will pay for an outcome. They necessarily won't always want to pay for a service. So this all goes back to, we have to differentiate ourselves from all these different practices out there. We have general offices that want to do it all. We have corporate offices that are doing it all. And we have dental implant clinics that are doing the full arch treatments for a lot less than what we can do them. So are we competing with them? No, we're not really competing with them because it's not apples to apples. But the truth is, patients don't know that. They don't know what we know. So we have to work really, really hard at differentiating ourselves. So that has to do with a lot. That has to go with really good marketing. If you want help on that, let me know. That's marketing direct to patients. That's marketing to your GD offices. That's PR. You have to really be good at marketing. If not, patients don't know the difference between you and those other facilities. The other thing is good phone answering. If you're not impressing them on the phone, they're not going to schedule the new patient evaluation with you, and they're not going to show up for that new patient evaluation, which is where you are spending those marketing dollars trying to get at. If you don't have a new patient special, get one now. It's not about making money off of new patients. Yes, you have a CT scan machine and you want to get paid for it. Understood. Yes, it's your time. Yes, it's your assistant's time. But if you don't have a new patient special, you are not going to be able to get those patients into your office to show them the difference between you and the other facilities. Because the fact is, especially those dental implant clinics, they're not charging anything for patients to come in. So it's a low investment way of getting in there to find out if this treatment is good for them, and they're not paying anything for it. So you can't have your new patient examinations where it's a la carte. It's for the exam, it's for the FMX and the CAT scan. If we do this, you can't do that because patients are they're gun shy on this, and they don't feel comfortable investing in you quite yet when they don't know if they're going to do treatment with you. Remember, these other facilities are a lot cheaper than you. So you got to get them comfortable about coming in. So it's how you answer the phone, having an attractive new patient special, get them in the door. Then it's their experience with you, the new patient experience with your assistants, with your treatment coordinators, with you. So you have to be able in that time, and if you watch my past videos, you'll know, and if you want links to those videos, let me know. It's about that experience where they are truly seeing, wow, this place is different. This is the best examination I've ever had. You guys are all so nice. I love you guys. I want to stay here. This is where I want to invest my money. Even though it's more, they want to stay and invest with you because now they trust you and they feel comfortable with you, and they know they're going to get a better outcome at your office than anywhere else. So these are so, so important. And going back to that fee for outcome letter, in order for us to show them and to prove to them that their investment is protected with us, you have to have a warranty. So I have a staff member, her brother needs full arch implants, all extraction, full arch implants, full arch prosthetics. And of course, he's going to come to our office and have this done. But we had an opportunity to go visit these other implant clinics. You know, all those, I can't say the names of them, but all those that you know that are all over the place. He went to 3 different ones. It is not anywhere near comparing apples to apples, but the one thing that they really do well is they really make their all-on cases so attractive. They show a before picture and a potential after, so you get excited about what your smile would look like. They show you the models. They really show you what they're going to be doing. They have literature that they've created to say this is what you're going to get. They get you excited with that literature. They have a warranty that makes you feel really good about investing your money. They're also a lot cheaper than us anyways, a lot cheaper. Some are $10,000 cheaper, some are $5,000 cheaper. We can't compete with that price. We have to keep our price because we have a higher standard level of care. Our staff is more expensive, our doctors are more expensive, our lab is more expensive, the stuff that we're doing is more expensive. Plus, we're not doing the extractions, implants, prosthetic. We are doing the extractions, the bone graft, maybe a second bone graft, a tissue graft, maybe a second tissue graft. We're doing first fade prosthetics, second stage prosthetics. We're making sure that the treatment that we're going to do is going to last the patients for the rest of their life. And we're also going to make sure that it's the best outcome ever. But patients don't know the difference. So you have to show this. So back to the warranty, fee for outcome. We make it known to patients that we are not charging them a fee for service. We are charging them a fee for outcome. And we're going to make sure that their money that they invest is secure with us. So that means we have to at least give them the same warranty that these other facilities are giving, which, what I want you to remember is no different than what you would do even if you didn't advertise a warranty. So advertising a warranty makes the patients feel more comfortable about investing a lot of money into you. So the warranty basically that these other facilities are giving is they're giving a lifetime warranty on the prosthetic, which is easy to do because if you look at the labs if you're having a zirconia prosthetic, the labs are guaranteeing this prosthetic with you. And there's a lifetime guarantee on the prosthetic of chips and breaks, which a zirconia is not going to chip and break and fracture. It's not going to. So you can give a lifetime warranty. The doctors that you're working with can give this because it's not going to chip or break. But if you're not, if you don't want to talk about the lifetime warranty on the prosthetic because you're not doing fine, but it might be something that you talk to with your general dentist about because it's not going to. Now, what we do is we have a warranty, and I can share the warranty with you, but we spell it out to say that we give a 5-year solid bite promise on the implants. And what that means is for 5 years, we're going to warranty your implants only if you stick to the guidelines of our warranty. So it's that if there is a failure, we have to do an A1C test to make sure that they're not diabetic because it's not covered if you're diabetic. We have them do a D3 deficiency test to make sure you're not deficient in D3 because studies lately have shown implant failures are directly associated with D3 deficiencies. So if you have a failure or an infection, we have you run that blood test, and if you are, it's not part of the warranty, so that protects you. They have to come for their maintenance. So for 5 years, they have to come and see you once a year for a check on the implant. So whether it's a single implant, multi-implant, or full arch prosthetic, once a year at least you have to come so the doctor can do x-ray on it. You can have a cleaning to make sure that everything is within the normal limits of the oral hygiene. Make sure that everything is being cleaned well. If not, we're going to educate you on that, teach you that. And they have to be sure that they're not smokers. So smokers it wouldn't apply to. So all of the warranty guidelines are on there stating that we have a right to call for the test. You have to have the test. You have to come for your cleans. You have to come for your checkups. You can't miss them. You can't reject them. You can't be a smoker, so on and so on. I'll share the warranty with you, but providing this to your patient really isn't any more than what you do now, because if you have a compliant patient that's coming back to see you, that's doing everything that they're supposed to be doing, of course you're going to help them and you're going to cover that. So for 5 years we do that. Now if patients are still being compliant, coming to see us once a year, and they are all within the guidelines of this warranty, we're still going to help them. It's not going to be free, but we're still going to discount it. We're still going to help them, because the point that we want to make with this is we will back up our product. We know that we're doing a really good job. We know that we're giving you the best care possible, the highest standards of care possible. And we know that we're the best to do this. And we know that we're doing more and better than anywhere else can do this, even though we're probably charging more, and I know we're charging more. And a patient, if you are being compliant and doing everything that we ask you to do, of course we're going to warranty these, but we warranty them for 5 years. Now, if you're talking about the lifetime warranty with the prosthetic and the implant warranty. The way we talk about that, and again, this is something that you'll have to talk about with your prosthodontist or your general dentist, is if the implants fail after 5 years, that prosthetic is not covered if it has to be replaced, because implants have to be replaced. So that's clearly stated on this as well. So if you want a copy of our warranty, just send me an email and I'll share with you our warranty. You are more than welcome to copy it. You're more than welcome to use it as a template to start yours. But when you advertise a warranty, it says you can trust us. When you advertise a warranty, it's at least what those other implant clinics are doing as well. And we have to be sure that we're in line. We do guarantee our product. We do guarantee our services. We do back up what we do. We're just putting it in a warranty form for them to sign, so they know what their responsibility is, and they know the guidelines of the warranty, which to them is securing their investment that they're making with you. So if you want to see our warranty, email me at Danielle, Danyel, at directorofdentistry.com. I'll be more than happy to share with you what we have proudly created this week for a dental implant warranty, which the patients are just very excited about. And you can see that it really helps them accept that treatment. Have a great day. Thank you.